Hi, it's the Shangloria here, your diabetes educator. So you're welcome. Today we'll be looking at the ABCs of diabetes, or you can also call it ABCs, diabetes ABC. So how well you take care of your diabetes actually depends on these ABCs of diabetes, because over time, high blood sugar actually leads to plaque buildup along the blood vessels and this makes it very difficult for blood to get to other areas or other parts of the body. So it's important that you keep an eye on your ABC for a better diabetes management. So what are these ABCs? A stands for A1C. That's hemoglobin A1C test. This test actually shows you your average blood sugar level over the past 3 months. It's like a scorecard that actually checkmates how well you've been taking care of your diabetes. And an A1C that is high shows already indicates organ damage is occurring, and it's important for you to aim for A1C that is below 7%, or you find out from your doctor what your A1C target should be. And this A1C is better tested 2 times in a year. The next alphabet is B. B stands for blood pressure. B stands for blood pressure. So keeping your blood pressure under control is as important as keeping your blood sugar level under control, because a high blood pressure exposes you to what? Kidney problem, heart problem, and stroke. And these are major causes of death among those with diabetes. C actually stands for cholesterol. Cholesterol is a gel-like waxy substance found in the blood, and in particular low density lipoprotein, which we call bad cholesterol, should be kept below 100 milligram per dl, because if it is high it can clog the arteries and lead to heart attack. So it must be kept under 100 milligram per dl, and this cholesterol must be tested like once in a year. Now S stands for substance like tobacco. So if you're taking tobacco, it's important that you stop, because several research have linked tobacco smoking to what? Heart disease, cardiovascular diseases, and also incidence of type 2 diabetes. So in summary, keeping an eye on your carbohydrate intake only is not enough for your blood sugar management. You must also keep an eye on your fat intake as well as your salt intake, so as to keep your blood pressure and cholesterol under control. And not only that, you must also make sure that you adopt a healthy lifestyle, especially including activity, increasing your activity levels. At least have 30 minutes exercise or physical activity per day. That is almost like 5 times in a week, making it up to 150 minutes in a week as recommended. And you must ensure that you manage your stress properly. You can engage in taking a walk. You can also listen to music, practice deep breathing, or get a small gardening just to ease up some stress. Then ensure that you have adequate sleep, at least 7 to 8 hours in a day. Ensure that you rest and limit your alcohol intake. All this, and also make sure that you take your medicine as prescribed by your doctor. All this can help keep your ABC of diabetes under control. See you next time.